doing MD in homeopathy, one thing I'm sure of that you are very serious about the career and you want to continue homeopathy long term. But I don't want you to make a few mistakes. Top mistake is not checking the college by going in the college. So after you decide to do MD, even before choosing a subject, choose a college. I would like you to go to the college, see the hospital OPD, see the other OPDs, pre-peripheral OPD as far as possible. See for yourself what is the clinical exposure of the college. Then you can decide thoughtfully that if the clinical exposure is less, then you can join somebody else's clinic as an intern side by side. So you manage both the things side by side. And if you're satisfied with the clinical exposure, you may just go and do MD over there. Most of the colleges, leaving 5-10 colleges, do not have a grand clinical exposure for every patient to see. Second thing I want you to do is talk to the previous MD students of that college. Nobody can give you a better glimpse of what the college is all about than the MD students. The previous MD students will tell you, is it more of academics? Is it more of clinical exposure? And if it has a balance of both of them, how firm are they about the academics, about the attendance, and how much you would be required to do the course, how sincerely you would be required. Although for now, most of the colleges, about 90 to 95% colleges requires you to do MD in homeopathy full time. There is nothing as such correspondence. The colleges who are offering that, I will sincerely say, don't go for those colleges. Third thing I want you to do is do plan for your clinic. How will you set up your clinic? Search for a rental space. In these 3 years, you should have a rental space ready with a rent agreement by the time you give your final MD exams. And second thing is get all your instruments, everything that is needed for the clinic. Third thing is plan it wisely, plan it nicely. Don't only go for reading the books, mastering the books, giving the exams, getting the marks. Eventually, you will be left after MD with the result of an MD, with the experience that you are holding, but neither with a job nor with a clinic. So you need to have a firm plan of how you're going to open your clinic beforehand. So plan for that, get the pharmacies that are available, get all the links of the pharmacies. जैसे ही आपका MD खत्म हो, you can establish yourself and you can plan accordingly. So do these 3 things while and before starting with an MD, and I think this will make you a very confident homeopath from the very beginning.